So good day everyone, good day man. So I am Maybe Ann E, Espinosa, one of the reporters in learners with difficulty in moving and walking, physical and orthopedic. So let's move to identifying learners with difficulty walking and moving. So first, we have physical skills checklist for teachers. So as a teachers, we must have a physical skills checklist for our students. So a tool teachers use to determine learners' functional physical skills and understand their physical needs in the classroom. So as a teacher, we must have a physical skill checklist for our students. So this is a diagnostics tool for classroom teachers, and its purpose is to systematically observe and document a learner's functional physical abilities and to understand their specific need within a educational settings. For example, getting in or out of a chair, manipulating object, or moving around the room. So it as a teacher, as a learner-centered teacher, we must mind our students, especially if they move around their chair, manipulating object or moving around the room. So we need our supports for that. So next is a formal screening and diagnosis done by a medical expert. So this is the process is mandatory for officials, classifications, and accommodations. So it must be conducted by medical experts such as pediatrician, neurologist, or physical therapist, to establish the nature and extent to the physical disability of our learners. So this formal diagnosis is crucial, for accessing specialized service and support to our students. So it's very important na to ang students with disability in moving and walking they have a formal screening and diagnosis for us to know as a teacher pod na aware ta kung unsa man ang ilahang or unsa na ka complicated or how we can address their disability and how appropriate way na tumbahaton as a teacher. So let's move forward to principle and strategies of teaching. So first is health professional service. So physical therapy. So use treatment techniques to promote mobility, reduce pain, and restore functions, and also to prevent further disabilities. So suggest settings, positions, classroom activities, and exercise. So as a teacher, we must promote. Especially in a classroom settings, we must promote an inclusive education. So with that, we would have our students they have disability in moving and walking. So we must have a mind their sitting arrangement dapat appropriate sa ilaha, their classroom activities also, and also exercise na appropriate pud sa ilaha nga dili maapektuhan ilang disability. So that is physical therapist. Second is occupational therapist, which is focused in fine motor skills and activities of daily livings or EDL. So they help learners perform daily activities like self-help, dressing, hygiene, eating, and employment-related tasks. So they also guide motor skill development for functional activities such as baking, typing, or writing. So occupational therapist is kanang good also for their daily life living na makatabang sila especially their hygiene, their dressing, kung maglisod man sila. Then, of course, other specialists such as this is multidisciplinary team can include speech language pathologists for communications and oral motor skills, adapted physical educators for safe and appropriate physical activity, and school nurses for medications administrations also, and health management. So we must also need other specialists for them to check especially nurses is appropriate for them kung sa man ang kanang problem especially if kanang in terms of emergency, so na tayo ma-call o na tayo ma-kuan in right side or in side sa tua as a teacher. So second is environmental modification. So these are the structure or logistical changes to the physical environment to remove barriers. So for us to promote or to promote an inclusive education, we must remove barriers for our students, especially if they have a kanang disability in moving and walking. First is accessible building levels. So locating classrooms on accessible levels. So if our students no dapat appropriate na kanang classroom sa ilaha is ground floor jud para di sila kaayo maglisod and hassle sa ilaha or near in elevator, pero since dili man kaayo tanang school na elevator, so it could be not kaan, but the ground floor classroom is appropriate and pwede nato siya ma-apply. Next is spacious areas. So, relocating activities or classes to more spacious areas allows for safe movement and maneuvering of mobility devices, just as wheelchairs or walkers, diba? Dapat appropriate sa ilaha, dapat ang ilang mga walkers or ilang mga wheelchairs makamove-move ra pod sa ato ang classroom, sa ato ang space sa sulod sa classroom. And third is adjustable furnitures. Of course, dapat ang ato mga desks, ang ato mga chairs, and tables should be adjustable in height and designed to operate for learners who has naa sa wheelchairs or specialized settings. So, dapat, for example, ato mga shelves, ato mga libro na butanganan, dapat maabot ra pod sa katong naglingkod sa wheelchairs. Dapat sila tanan maka-access, including naglingkod or naglingkod sa wheelchairs or sa specialized na settings. Dapat makaabot sila or maka-access sila ato. Next is adequate floor space. It is most crucial no kung adequate floor space. So designating and providing sufficient unobstructed floor space no for parking wheelchairs in the front side or rear of the room, ensure that they are accessible without impending classroom traffic. So dapat especially no sa ato ang mga students nga naka-wheelchairs, dapat no if ibutang na to ang ilang mga wheelchairs in appropriate way, dapat pod nag-need na nila ma-access ra pod nila dayon. So it's about floor space. So as a teachers, it's about us, our decisions, our how we think and how we just feel them, how we care for them is matter. So dapat kita as a teacher, we must be mindful to our decisions. We must be mindful to their feelings, to their hustleness. So as a kanang as a teachers, dapat tunaon sa nato. So last is response modification. So this is pedagogical modifications now that allow students to demonstrate knowledge in different ways, such as accepting spoken responses instead of a written one. So manita no atong students naglisod man siya og written kanang written report or written assessment, naglisod sila on how the way they answer or how they assess no pattern in written way. So maglisod sila. So dapat kita as a student, as a teacher kanang mag-provide tag laing strategy or lain a way like spoken responses if appropriate sila. We need differentiated instruction for them no, differentiated strategies that appropriate for them. So, katong spoken responses instead of written ones, so depending na to siya, depending on the learner's dexterity or communications abilities sa ilaha. Depend lang siya kung saan na-appropriate nga spoken responses ang atuang i-apply sa ilaha. Third is assistive technology. So here, for mobility, so these devices compensate for limited physical movement. So, for example, sa mouth stick, so a device held in a mouth and manipulated by the tongue and lips to interact with technology or objects. So, ang head one, so a rod attached to a headband that allows a users to interact with the keyboard or touch screen by moving their head. So, it is one of the instrument na gamiton nato if need sa learners kaning mouth stick is appropriate sa ilahapod. We can also use scooters, walkers, or canes, crutches, orthopedic devices. So these are the traditional and specialized devices for ambulations and body support. So itong students man naglisod og kanang walking and moving physical disability man nila ha. So if ato ang school dapat na sila mouth stick appropriate kay need jud sa students, or it could be scooter, mga walkers, mga canes or crutches, or the orthopedic devices para sa ilaha, para di siya maglisod jud, pero they feel na they are equal to, or the equity of the students dapat ma-acquire nato or makuha nato ilang needs maglisod na gud sila if na sila sa classroom setting, especially inclusive education, diba? naglalahi nga mga disability. For example, in one classroom settings no na ay like niya ni disability in kanang physical no in walking and in moving. So dapat ang classroom or ang kanang school dapat mag-provide og bisan man lang og kanang tree or kuan na strategy or instrument for the students nga naglisod jud, like mouth stick or mga scooters or walkers or canes or orthopedic mga devices. So that is for mobility man to siya, no? So next is for communication. So these tools no addresses difficulties no in expressing thoughts or accessing informations. So for those students who naglisod og accessing or expressing their thoughts and accessing information, so it could be first is the tools that they need is speech recognition software. So these technologies convert spoken words into text and allows the users to operate a computer or navigate online using voice commands instead of a keyboard and mouse. Hello Siri, himay ana ko dapat naa sa ilaha or speech recognition software must be appropriate and must be naa sa ilaha. Next is speech generating software or augmentative and alternative communications or AAC. So it means this includes standalone devices or software that install in tablets or phones, so it allows non-speaking users to communicate by synthesizing speech from text input and selections of symbols or pictures or pre-recorded phrases. So nindot po ni siya ang speech generating software augmented and alternative communications or EAC for students nga na naglisod og access, naglisod og about communications, difficulty in communication. So let's move forward to inclusive classroom approach. So, the teacher must first observe and ask the students with disability, including not disability also. So the teacher must observe and ask. So teachers should observe learners to identify when they need assistance, but must always ask if their support is desired before intervening. So this respect also the learners to their autonomy and avoids the assumption that they always prefer and need help. So as the teacher we need to be mindful, observe and ask. So if dili ra need kaayo nila, di ba? Naman po ubang mga students na kanang kuan, diba, dili ra kaayo need kayo ang support, so it could be okay para po sila hang learners autonomy for self autonomy also na mabuild nila. Next is accurate and sensitive terminology. So use person's first language. So dapat dili ta miingol na learners with a physical disability instead a disabled person. So and avoid outdated, judgmental or sensationalized terms. So as a teacher bawal yun na sa to. It could be makalabag ta sa code of ethics kanang magpataka tawag kanang og term basta mga especially with disabilities sa atong students. So makalabag ta na sa code of ethics, so we must avoid that, we must prevent. Next is a make eye contact. So, of course, when communicating, we need make eye contact. So when conversing or focus on one person's face and engage in a direct eye contact. So rather than focusing on their impairment, sikog tan-aw, sikog judge, bawal yun na sa teacher, so or assistive devices. So this validates the learners as a whole individual. So make an eye contact with sincere, genuine care sa tuang students. Next is reasonable breaks. So, allow reasonable in-between breaks, especially for activities that require travel time, like example, moving between classroom or to the washroom or the physically exhausting. So, dapat we need taga na to sila enough time if nang need pa sila magkanang batabaktas padong dire sa kanang moving between classroom or to the washroom, dapat manghunaw pa sila after the activity, so taga na to sila time ka para sila maglisod basing magdagan-dagan ug basing maunsa pa natong students. So dapat kita initiative ta as a teacher, taga na to sila enough time na makabalik sa tuwa. So next is recording the lectures or note takers. So, allow the learners to record class lectures for later review or provide a note taker, either a peer or a paid aide. So, this ensure that they can focus on processing informations during the lectures without the physical difficulty of simultaneously taking notes. So, especially loy kayo itong mga students with disability pa jud kanang dili pa jud nato sila require nag notes after sa discussion, no? Dapat require nato sila notes kay para ay mag-discuss ta, maminaw sila ug di sila maglisod nagsuwat na naminaw na di ba kuan pa ilang lawas. So dapat kita recording lectures dapat before or after nato sila nga tagaan sa ato ang discussions or soft copy sa atong discussions or topic. Next is pair pairing in labs. So involves learners in practical classes such as laboratory work by pairing them with able-bodied learners who can safely and easily carry out the physical or manipulative procedure while the learners with disability directs records data or perform other non-physical tasks. So for now, when we grouping them no into activities, dapat mag-mind ta na kato na learners, dili man jud tanan pong learners in inclusive education kanang disability sila. Naman po'y kanang okay, walay disability. So dapat i-partner na to sila para po katong na disability, dili sila maglisod. For example, katong walay disability na learner, siya ang muak sa physical na kuan, din katong disability in moving and walking siya tong mag-dictate or siya to ang kanang magsuwat, di ba? At least nakatabang sila, collaborative of the kanang kuan. So pairing in their classroom or communicating or kanang collaborations na in the classroom is very effective, especially with learners with disability. So ato ang mga students makalearn po sila through the knowledge of others. So through the knowledge of others or learning by doing, makakuan po sila learning by doing with their classmates, no? So dapat kita we must also have pairing no sa atong mga activities, sa atong mga physical activities in the classroom during discussions or any activities. That is it. So we've done our discussions and we have now our summary. So learners with physical disabilities are characterized by long-term limitations in mobility and dexterity, so often due to conditions like cerebral palsy or muscular dystrophy. So effective teaching relies on a structured process such as teachers' checklists for initial systematic identifications. Next is collaboration, so working with physical and occupational therapists for professional support and intervention. So inclusions requires a strategic approach dyan. So first, we must have this strategic approach, ang assistive technology or AT, so the use of specialized device for mobility. Example, wheelchairs, mouth stick, and communications like speech generating devices. So for comprehensive environmental, so modifications like making the physical space accessible like the ramps or the adjustable furnitures, the chairs, and the spaces of our physical classrooms. So we need to be mindful, no, as a teacher. So it's all matter to us, the way we act, the way we generally act, no. It's about dedications and passions and full care for our students. So especially in disability, in walking and moving. So as a teacher, dapat flexible ta, dapat mindful ta, and dapat ma-feel nato or dapat mabantayan nato students nagkalisod niya na dapat in an appropriate way ma-address dayon nato, no, or ma-address dayon nato as soon as possible. So that's it. Thank you. I hope you learned something for our discussion, the disability in walking and moving.